Social and behavior change communication is a crucial element of any nutrition intervention. There have been many successful nutrition behavior change projects around the world, but most are not implemented at large scale, and sustainability or cost effectiveness of the interventions are not known.
Behavior change matters. We believe that it matters at a societal as well as at an individual level.
We can no longer afford to proceed with small pilots. We know what works, and taking that to scale is where the impact is going to be for global development benefits.
The way forward is really to start to scale up all our work so that we start to include SBCC in the major nutrition platforms. And that really means starting to build on the results we have so far and the learnings we have, and really start to advocate so that we are including SBCC in all our work.
Throughout 2014, GAIN and USAID Spring reviewed the evidence and consulted global thought leaders to identify priorities for nutrition behavior change. Working at scale to maximize nutrition impact emerged as an urgent priority. The Designing the Future of Nutrition Behavior Change conference brought a broad range of experts together to shape a strategic agenda for getting to scale. Examples of great at-scale behavior change programs helped jumpstart the discussion.
We use radio and television, and we use dramas and comedies to tell people what they need to know. We've constructed mathematical models which tell us that mass media could actually be cheaper than any other method of saving children's lives. So we're testing those predictions.
In Vietnam, we began by listening to mothers, to grandmothers, to health workers. We learned that our breastfeeding campaign would have to bolster their confidence that their breast milk was enough to sustain their children for 6 months. During the 4 years that Alive and Thrive operated full tilt in Vietnam, in the areas where we had mass communication and interpersonal counseling, exclusive breastfeeding rates tripled. We created a program model for scale that could be replicated worldwide.
Partnership is a fundamental concept for nutrition, given the huge challenge we have to reach billions of people who suffer from malnutrition. So as we scale up SBCC programs, we need to bring in new partners, particularly from the private sector, and try and start to use those skills.
In India, where 36,000 people were killed over the space of 10 years while crossing train tracks, the Mumbai train system implemented a design approach that added strong visual cues to the physical environment. This led to safer decisions and reduced fatalities. Nutrition can apply similar approaches that address the unconscious and habitual drivers of behavior.
As opposed to going and telling people how they should behave, if we have a good understanding of how they take decisions in their real life, we can design stuff that works for them.
We believe behavior change matters. We also believe that the evidence is there, both in nutrition and for societal and behavioral change that works.
GAIN, Spring, and USAID are just 3 organizations. We've committed to adopting an at-scale mindset about SBCC, and we invite other funders, donors, implementers, researchers to join us in committing to this agenda.